Post-TURP bladder neck is a well-recognized cause of obstructive voiding symptoms after prostate surgery. These patients typically present with progressively worsening flow, straining, and incomplete emptying. On evaluation with uroflowmetry, there is a plateaued flow and post-void residue. Cystoscopy usually confirms a dense near obliterative stenosis at bladder neck. Before incision, it is important to assess and calibrate the bladder neck. In very tight or near obliterative stenosis, a Teremo guide wire can be placed over which a RGC catheter can be threaded to insulate it before making the incision, which guide us about depth of incision. The goal of endoscopic management is to restore patent wide lumen while minimizing the risk of recurrence. A controlled transurethral incision using Mercedes-Benz pattern has become a reliable technique for complex stenosis. This involves making 3 deep radial incision at 5 o'clock, 7 o'clock and 12 o'clock position at the level of stenotic segment, creating a star-shaped opening reminiscent of Mercedes emblem. These incisions are carried through the fibrotic tissue down to healthy pliable mucosa, taking care to stay within the safe surgical plane and avoid excessive bleeding. Once the stenosis is incised, we can achieve a good hemostasis. Evidence support the use of adjunctive antifibrotic therapy such as Mitomycin-C. Mitomycin-C is an anti-neoplastic agent with antifibroblast activity. Has been used at low concentration to reduce scar recurrence. After incisions are complete and hemostasis is secured, mitomycin is infiltrated at multiple sites around the incised fibrotic ring, typically circumferentially using a fine endoscopic needle. We can inject the mitomycin till we see a bleb forming near the incised area. The intent is to modulate wound healing, reduce excessive fibroblast proliferation, and lower risk of re-stenosis. This practice is backed by several studies showing improved patency rate when compared to incision alone, though dosing and technique should be tailored to individual patient factor and institutional protocol.